Hello everyone. My name is Stuart Ryan. I'm co-chair of the Ottawa Health Coalition, and I'd like to welcome you all to the public consultation organized by the Ontario Health Coalition on getting input from the public on how to improve Ontario's hospital services. I think they're having panels like this across the province. There was one at Thunder Bay and Niagara Falls where they had a good turnout, and there'll be many more of these. So this is Ottawa's turn. The Ontario Health Coalition is an organization that has 400 member organizations and a network of local health coalitions, such as the Ottawa Health Coalition, and it has members include seniors groups, patient organizations, nurses, health professional organizations, unions, physicians organizations that support the public health care system, nonprofit community organizations, student groups, ethnic and cultural organizations, and others. As I said, the Ontario Health Care situation has been over a decade of underfunding or freezes for provincial governments for 9 years, and the increases over the last 2 years have not met the standards of living. For Ottawa, they would need another $312 million to make it up to the national average, and that was all that was given for the whole province 2 years ago. So we're here to get input from the public. We have quite a list of individuals and organizations who are going to make presentations today. I'd like to introduce our panel here. Just one thing to say. One of our panelists, Alan Drummond, who is an emergency hospital surgeon, had to cancel out because he's short-staffed at his hotel in Perth. So he can't make it, but the others are here. I'd like to introduce them. Starting on my right, Ross Sutherland. He's a retired nurse who's worked in hospital emergencies, addiction programs, palliative care, and home care. He's co-chair of the Kingston Healthcare Coalition and chairs the executive board of the Ontario one. And in his spare time, he's a counselor in South Frontenac Township. Next to me is Patty Coates, who's the Secretary-Treasurer of the Ontario Federation of Labour, elected in 2015. She's an educational assistant, has been on numerous boards of the Ontario Secretary School of Teachers Federation, negotiating, and past president of the Barrie Federation of Labour Council. Natalie Mera is here to my left, is Executive Director of Ontario Health Coalition. And I'll just say the Cornwall District Labour Councillor calls Mera a warrior woman, the heroine of public Medicare, whose tireless and informed advocacy continues to protect public health care from, quote, rapacious privatizers on one hand and cash-strapped governments on the other. And our last panel member is Mike Burleigh, who told me to keep it short and sweet. So he's been the president of the QP Ontario Council of Hospital Unions since 1990 and serves on the National Executive Board. So I think the panelists all want to say a few words before we hear from our presenters, and there's 3 or 4 of them here right now, so we'll be ready to go when you guys are finished. So who wants to start? Ron?
Your chair. Okay.
I'll finish.
Okay, thank you.
Okay.
Anyway, I'm thrilled to be in Ottawa, and it's my old hometown, and so I always like coming back and seeing people I know. It's wonderful. And I actually look forward very much to hearing what you've got to say today. The only thing I wanted to say by way of opening comment is that think over the last 30 or 40 years, we've had sort of the general sense that we've had a series of defeats, cutbacks, privatizations, and sometimes I think it gets overwhelming, even though we all do know that there are some small victories we've had. But to start with, it's meetings like this where people put forward ideas that form the germ of what we want to bring about next. So that we're not always just fighting an offensive battle, we're actually putting ourselves into an offensive battle. And I think that's extremely important, that we have this process of opening up those possibilities. And the second thing I want to talk just a little bit about is laboratories. Because in laboratories, it's very interesting that even though these last 30 or 40 years we've seen some, like I say, fairly significant setbacks in our public healthcare system, in laboratories, in a couple of provinces, we've actually seen some big victories. And I go back to 1995, when Saskatchewan, for a series of reasons, but certainly not least of which was the pressure of a Canadian Union of Public Employees, the entire laboratory section was nationalized. And it has stayed nationalized since then. So they've got a completely public laboratory system in Saskatchewan. And secondly, I just want to go to Alberta, because Alberta is a really interesting case for a whole series of reasons. Also starting around 1995, the Conservative government under Ralph Klein at the time, for entirely financial reasons, forced the private companies in Edmonton and Calgary into consortiums because they were so completely out of control in terms of their costs and quality that it was unbearable for the healthcare system. And what happened as a result of that, once again, partially under the pressure from the Alberta Health Services Union, was that first Calgary became an entirely non-profit provider of laboratory services. The private labs were completely cut out. That took a process of about 10 years. And then when the NDP government got elected recently in Saskatchewan, there was a series of scandals around the further privatization of Edmonton's laboratory services, and their response, once again, partially under public pressure, but actually for a lot of reasons, was to take all of Edmonton's laboratories in hospitals and in the community and turn them back into the public sector. Now that's in the process now, and it won't happen until 2021. And the last remaining private lab in Alberta, which was in Medicine Hat, has also now been deemed to go the same way. So by 2021, all the medical laboratory services in Alberta will now be back in the public sector. So that's a significant victory. Even in Ontario, where I think the laboratory sector has seen sort of continual cutbacks, there's now a regulatory change going through the process in the bureaucracy, which will allow us to bring some of the, especially in the rural and small hospitals, bring some of the labs back into the public sector. Partially because the private sector just didn't work in those areas. And that's part of the story, but it's also, there's no doubt that part of the story is the pressure from the Ontario Health Coalition, the pressure from OPSU, just has kept up that fight all the time, highlighting that it doesn't work, and it really doesn't work. So we can make victories, and I just wanted to make that point, and they start with hearing the ideas that you've got about how to improve things, and then we just carry it through, and we fight, and we can win them, absolutely.
Thank you, Russ. Next will be Patty Coates.
Thank you. It's wonderful to be here in Ottawa. Although it is not my hometown, it's becoming my second home, as my daughter has lived in Ottawa for 15 years, and just until 2 months ago, she actually lived just down the street from here. So I'm glad to be back here. The Ontario Federation of Labour is the umbrella organization for unions in Ontario. We represent nearly 1 million workers, working people across Ontario, from 48 unions in the public and private sector. We also have the voice for workers who are not unionized in Ontario. On the wall in the Toronto Labour Council office in Toronto, there is an old black and white photo showing a public rally either prior to or around the time of World War II. The marchers are carrying handmade signs, and the signs say, "Farmers and Labour unite for healthcare for all." The picture is from a time before we had public healthcare in this country, a time when families traded pigs and chickens for medical care, or mortgaged their homes, or sadly, died in pain without the needed care. Unions fought alongside veterans and farmers to push our governments to create public health care because people were suffering and dying without it. Unemployment insurance, minimum employment standards, pensions, an end to child labor, pay equity for women, the movement for universal child care, and an end to tuition fees. Many people don't realize that unions have been at the forefront of social movements for the last century and a half to win all of these things to improve the lives of all workers in Ontario and their families. And health care for all is one of our priorities. We were in it at the very beginning when we worked with the farmers to unite in a call for public health care for all Canadians, and we're in it now. To protect public health care from privatization and to improve and expand upon the services we readily rely on. We believe, like in this process of public hearings, that public policy belongs in the democratic arena. Our hospitals belong to the people of Ontario, or they should. We fund them through our taxes. Most of us are born in them. We rely on them throughout our lives, and many of us will be in them at the end of our life. Our priorities must reflect in the political decisions about the future of our hospitals made by our provincial government. Let me ask you, does anyone in this room think that the hospital cuts would have continued over the past decade if we voted on it? I don't think so. No way. And we agree with you. Vital public services, our hospitals, our schools, must be protected and improved, not cut and constrained. Like most of you in this room, I've experienced what hospital cuts have done to our healthcare system. I could spend hours sharing my personal and family stories, but I'm here today to hear what you have to say. Thank you so much for coming and for sharing your ideas, your experiences, your perspectives. And I'm looking forward to hearing from you, and will listen intently on what you have to say. Thank you.
Thank you, Patty. Next, Michael.
Thank you, Stuart. Thank you very much for coming. First of all, I'm not going to tell you anything you don't know. Ontario is operating a bold experiment in lack of capacity for its hospitals. It has the fewest amount of hospital capacity available to its population of any country in with a developed economy in the world, as you know. The fewest beds to population, the fewest staff to beds, the shortest stay, the highest occupancy rates which would be considered dangerous if they were in another jurisdiction like Great Britain, but what do they know anyway? This is not something that's actually stopping, it's accelerating here in the Champlain-Lynn with plans to close complex continuing care beds across the region and continue downsizing. So I want to talk about funding for just a sec. You know that hospitals require about 5.3% a year to meet their basic needs, but they were promised 3.1% after some really heavy lifting by the Health Coalition. But many hospitals are going to get 2, and some are getting less than 2. Under 2 in Kingston, Ross, for example. That will feed the downsizing, which it's meant to do. It's meant to drive the hospitals to continue to cut beds and services and to move those into the largely unorganized community sector. And you should know that all 3 political parties basically agree on this approach. This isn't something the Liberals are doing under a hostile barrage from the NDP or from the Conservatives. In fact,
Sorry, we can just tell them that they can come in if,
Yeah.
yeah.
In fact, the NDP, in its own hospital funding policy, would fund them at about 3.3%. They wouldn't fund for their utilization, and they wouldn't fund for their aging, which we would have to do. You need the basic inflation, you need the inflation, you need the utilization, and you need the aging to be able to make these things up. And the Tories don't tell us what they would do, but they are saying that they would cut Ontario's $315 billion debt, and that can't be done without cutting the largest budget item in the Ontario budget, which would be hospitals. So I think funding is something we have to talk about. But I would say, in conclusion, that it's good to have a discussion about hospital reform, because we also can't ignore the fact that hospitals are undemocratic. They're governed by wealthy people. They always have been. They make decisions which are not accountable to their communities. The new building of the new Ottawa hospital on the experimental farm, when they were offered Tunney's pasture just down the road without disturbing prime farmland, is an example of an autocratic institution which is immune to the pleas of its community surrounding it, right? These institutions are largely hostile to their workforces. They're reliant on discipline to make the whole process work, they're deeply undemocratic. I think we have to talk about that when we talk about hospital reforms, because presumably these institutions should be better funded, but they should also be accountable to their communities. They should also be under democratic control, and they should also be respectful of their workforces, which isn't actually currently the case. So with those remarks, I'll just stop.
We're going to hear a lot of things like that today. And our next speaker is Natalie Mera, the Executive Director of the Ontario Health Coalition.
Thanks, Stuart. Thank you. I thought it was really important that we look at a democratic process to try and protect our hospitals. Through all of these years at the Ontario Health Coalition, what I found is that when they don't give you democracy, if you take it, if you hold a referendum when they don't give you a vote on it, if you hold public hearings, often if we can organize enough participation, if we can let the community know, and people do care about their hospitals as a top of mind issue, as a top priority in every community that I've gone to in Ontario, that we can actually impact public policy significantly. About a decade ago, we held a series of public hearings on small and rural hospitals across the province. More than 1,000 people attended the hearings. We got about 600 submissions, far more than any normal legislative hearing would get. And out of that, we wrote a report with concrete recommendations about protecting local small and rural hospitals and their services, about progressive reform in them. And we made a huge impact with it. We didn't get all of our demands by any means, but we did actually win significantly improved funding for small and rural hospitals. We stopped the closures of the small and rural hospitals. We got the issue of a core basket of services onto the public agenda, and it's been sort of key on the agenda for that sector ever since. And some of our key issues around the LINs and governance and those sorts of things have also been addressed, not necessarily in the way that we want to, or become key issues. This process can really work if we do it well. And so I'm really pleased for all of you that are here today, and I hope that what you'll do is go back and spread the word. There's still lots of time till the end of October. We're accepting written submissions, so people can send in their submissions. They can be as informal as a handwritten note or as formal as a full-on typed up submission, but we would like to receive a great deal of input from a wide range of people who are concerned about protecting and improving their hospitals. I'll just finally say this. Michael's outlined the cuts to hospitals in Ontario. They've been, they're unheard of. Like, the level of cuts is unheard of. To put it in perspective, the British hospitals, the London hospitals, have been running at rates of of occupancy that range like from 85 to 90%. In Ottawa, your hospitals have routinely been running at 110% capacity or more. A whole bunch of them have been. These levels of overcrowding are dangerous by every piece of literature. I mean, there is nobody who could claim that they're not, that it is safe to run a hospital at that level of extreme occupancy. The chief argument that we hear from paramedics is that their ambulances are taken off the road, and in many communities there are no ambulances on the road for hours at a time because they can't offload their patients because the emergency departments are full to overflowing. You know, from patients, we hear about elderly people who have canceled vacations or canceled going south for the winter because they're supposed to get their hip or knee surgery done. Their hip surgery ends up canceled because the hospital has run out of money for that fiscal year and rescheduled to the next financial year, if you can believe that. Because, you know, it's an icy winter and a lot of people fall or things like that. I mean, this is no way to organize a public health system. It's not acceptable. And we have to rebuild people's expectation that they actually not sit for 12 hours, 24 hours on a stretcher in a hallway, that their elderly parent is not subject to undue pressure from the moment they get into a hospital till they leave. That we don't have hospital officials going on the air telling people not to visit their emergency departments. I mean, it's ridiculous. And I believe that we can do this, but the only way to do it really is going to be to make this an election issue. We fought as hard as a group could fight for 10 years on this. And so this is our idea to do it. This is a great start here in Ottawa, but there, you know, this is a town of what, 700,000 people, a million, more than a million people. So I think what we could do is, if we leave here with a renewed commitment to get out the word, to ask people to make submissions, we want to hear the good. So great best practices that could be shared across the province, you know, ideas about how to improve the system, the horror stories, people's experiences, and we'll put those together and analyze them and come up with a set of reforms that we'll use to pressure all of the political parties leading into the election for concrete promises of reform and for the level of funding, 5.3%, that we need. But we need to make sure that that money goes to care and not to exorbitant executive salaries and reams of consultants and bean counters and so on. So we need some ways to make recommendations to assure ourselves of that. And we also want to be sure that our hospitals are run in the public interest and in a democratic and socially just way. And so looking forward to your ideas, and thanks very much for coming today.
Well, thank you, Natalie, and thank all the panels for giving us good ideas to present. I know the presenters are going to present both personal experiences and also some concrete proposals for Ottawa and for Ontario.